So we say best diagnosis, physical examination in the abdominal area, we including inspection, the first inspection, and we looking what it appearance, look like. We looking for the birthing movement. We looking for the veins. And we also looking for the stomach and intestine kind of movement in there. When we talking about the palpation, so palpation we looking for the abdominal area reaction for your hand touching. And we looking if they have some tenderness of a rebonded pain in there. And we also palpation for the liver, gallbladder, and other organs in abdominal area. And we also palpation for the limbs. And we have two special tests in abdominal area. One go to McBurney's points, one go to Moffitt's size. We're talking about some detail later. And abdominal percussion, basically, we try to find the organs location in there. So the organs mainly including the liver, including the stomach, including the spleen and the kidney. And we also looking for some signs. That's basically some water or liquid, because people have special kind of illness, and the water moving in the abdominal cavity. So that's the size in there. And the auscultations, basically we hear the bone sounds. Normally we can hear the bone sounds about 4 to 5 times per minute. If too much sounds in there, it's kind of sick. If too less sounds in there, still kind of sick. We also possible can hear some blood vessels sound in there, but we need to separate with sphincter's heart sounds if people got pregnancy. But generally say, the heart sounds coming from sphincters is pretty high. Coming from the mouth is less or about 100 beats per minute. So that's the general picture about abdominal examinations. Now let's go to some detail. So before we talk about abdominal examinations, we separate the abdominal area for a few parts. So we have different ways to separate. One simple way, we separate through the umbilicus. Make one transverse line, one straight line, and then separate the abdominal area for 4 parts. Left side and the right side. Left side upper, left side lower. Because we separate 4 parts here, that's we say quadrant here. And the same thing, right side upper quadrant and right side lower quadrant. So that means if we find something in some area, we can record it, like where you find it. You are not only say, I found a big mass in the abdominal area. we need to say where it is located. And also patient have painful situation. They may tell you happens in the right side upper quadrant area. Thus, by the anatomy location, we may think about as possible liver or gallbladder issue. If they tell you happens on the left side upper quadrant area, that's possible stomach issue. And if happens on the right lower quadrant area, we especially talking about this area later. That's appendix located in there. Maybe infection happens in there. Truly, no special organs on the lower left quadrant area for male. For female, maybe some organs in there, but for male, it's nothing special organ in there. Maybe just if we find some muscles in there, maybe just the stool, like some people got constipations and the stool didn't pass in, and the stool blocking in there. So that's truly by the physical location, we can get some basic idea what happens inside. So that's the simple way. Yeah, that's the simple way. And clinically, certainly sometimes we use other ways. We separate abdominal area for non-part, by its location, and then we name it. So this way is not that common, but just let you know, if you name it different way, that must be separated by non-part like this. So that's generally we separate abdominal area to different parts. So certainly we need matching with separate different parts with our anatomy pictures. So by our anatomy on the right side, upper quadrant area mainly, certainly liver go to left side a little bit. So that's mainly the liver area. So if patient have right side pain, maybe the liver issue, maybe the gallbladder. Gallbladder holding under the liver. And the left side mainly part is the stomach. Spleen behind the stomach, and the spleen usually not cause the painful situation. And the lower part, middle is small intestine, and around the small intestine, that's large intestine, and the pancreas in the center. Pancreas, basically in this area. So that's we need much or regions with anatomy picture. So that's the same thing if we separate with non-part, the anatomy relationship like this. Like a few years ago, truly, some people go to board exam. They have questions there. They talk about some people have lower back pain located on the right side lower quadrant here, and then they give you some multiple choice questions there, 1, 2, 3, 4, or A, B, C, D, E. Is liver, gallbladder issue, or stomach issue, or large intestine issue, or some stool in there. Certainly, if you go to the left side, lower quadrant there, it's just stool there, not other organ in there. So you should have an anatomy picture in your mind. Then you know what happens in there. So these pictures especially show you where the pancreas is located, and its relationship with small intestine. Duodenum is the first part of small intestine here, and here is the pancreas. Here is the pancreas. And the ending part of pancreas reach the spleen area. So it basically covers part by the stomach in fact. So, okay, anyone could hear or not? Still not? Can you hear now? Okay, if you couldn't hear, but other students can hear, you can login out your Zoom and then login in again. Yeah, sometimes Zoom have some trouble. Yeah, try to login out and then login in. Yeah, if everyone couldn't hear me, that must be some trouble in my side. If other students can hear, only one student couldn't hear, that's trouble in your side. Yeah. Okay, no problems. Yeah. Yeah. Can you? Yeah. Okay. Yeah. You just try. If everybody can hear, if you couldn't hear, you just log out and log in. Yeah. Okay. So this picture here still tell us some location relationship with anatomy of the organs, and some painful maybe coming from different organs. So pretty similar like we talking about before. So like right upper quadrant here, or even some pain from stomach. In this area, basically, it's cover this part. So more go to right side, mainly go to liver, gallbladder. But if more go to left side, or sometimes even in the center, that may be coming from the stomach, or small intestine, or pancreas. So that's some more area is like a cover here. And this area mainly coming from intestine. Yeah, mainly coming intestine. But still possible coming from appendix. And the lower part, lower part. So we have big cover here, and we have a small cover here. So basically, large intestine, bladder, uterus. So that's basically still by the different location, we try to figure out where the problems coming from. Okay, so now go to our physical examinations one by one. So we say physical examinations, we have 4 ways. the first way, we always go to inspection. Inspection, or looking, just use our eyes to try to find if something happens in the patient superficially, then we can see. So basically, when we examination for the patients, for abdominal area especially, basically we standing on the right side of the bed. So patient should be lay down there. Yeah. When we checking about the abdominal area, patient should be lay down there. And also tell the patient bending their knee. Because when they bending their knee, the abdominal area muscles will be relaxing and it's softer. When we palpate, it's much easier to find the organ inside. If not bending the knee, the muscles will be tight in abdominal area. Very hard to palpate. So that's the normally we tell the patient lay down there, and then we standing on the right side of the patient. Right side is the liver side. So when we palpation, we say mainly we try to palpation for the liver. And you use your right side of the hand. It's easily to palpation for the liver. So that's why we talking about specially position. We checking for abdominal area. We didn't talking about in the chest area, especially like which side we standing there. But for abdominal area, truly we go to right side of the patient. We say right side of the bed here means right side of the patient. And then we inspection the abdominal area. So generally we looking the general shape of the abdominal area. We still talking about both sides. Basically, it's pretty similar. Not like one side is bigger, one side is smaller. And also we see if we can find some movement coming from the stomach or intestine. Yeah, it's not everybody you find like the movement coming from stomach or small intestine. But for some people you can find. We find the movement. So that's basically we just looking at the shape, or maybe some people have too big belly in there. So that's we can see. Yeah, we can see. Basically inspection in there. Certainly, same time we can try to see if we have some skin issue in there, and also blood vessel in there possible. We say normally, we couldn't see big blood vessels or big veins in abdominal area. But mostly if patient have some special kind of liver issue, then we can see blood vessel or veins in abdominal area, and the possible pretty bigger. So that's generally we see. Certainly sometimes we can tell the patient sitting there, and then we see some detail there. Sorry. That's the most part of our inspections. So just like the picture here, so that's basically pretty normal in here. Abdominal area look like a little bit bigger here. But some people have fat tissue there still belong to normal. Normally we can see the people mostly like this shape. But a little bit bigger there is not big issue. We need more examinations and then we can say some abdominal situation. So basically like this, it look like normal. So inspection, we go to more detail here. What we're looking for? What we're looking for inspection? Skin. Skin have some scar tissue, like people have injured before, or maybe they have surgery before. They possibly have scar tissue there. So basically, we try to mention where it's located. And also, we can draw a picture sometimes in the abdominal area. And especially some people have some surgery and leave the scar tissue in that area. Or you can just mention in the right side lower quadrant area have a scar tissue and about 3 centimeters. So that's basically we mentioned. And the second part we're talking about the vein. We find or we're looking. The vein we say usually we are not see the big vein in the abdominal area. But if some vein getting bigger and a lot of big vein in the abdominal area, that should be abnormal. Normally we just possibly see some small vein in there, just a couple of them, or even you didn't see, that's still normal. Even you didn't see small vein, still normal. But if you see the big vein in the abdominal area, that's abnormal kind of situation. Then we see if they have some skin rash in there, or some injury, or ulcers in there. And then we mention in which part of abdominal area, what kind of skin rash, how big it is, what's the color in there. It's about the skin or maybe the same level of the skin. And what kind of damage in there, and what's the color in there. So that we can go to some detail. Then the umbilicus area. So umbilicus should be located in the center line. And some regular shape in there. It's not too bigger, not too small. And certainly some people got a deviation, go to one side. We still need to recover. That's possible because some internal organs disorder, pull or pushing to one side. Or maybe some people got some surgery before, then moving the umbilicus to other side. So that's basically we're looking for some location and the shape And also some people have hernia. We still try to find where it is and how big it is. Let's go to that area. And then we're talking about the shape of the abdominal area. Like is the flat or rounded? Yeah. Or some special part, special protrude. So that's still belong to our inspection or looking. Then we say both sides abdominal area should be same shape. If patient one side is too bigger, one side is too thinner there, it must be some trouble. So whatever the shape, both sides should be pretty similar. Yeah, pretty similar. Thus be normal. We try to separate the normal condition and the abnormal condition first. Then we figure out what it caused. So basically, we try to find if some abnormal condition in there. Then we looking if in somewhere we can find the organs or muscles. So I would like to say normally we couldn't find like organs shape just by inspections or muscles just by inspections. Mostly when we palpation we can find it. But for some people, like people poor nutrition, there are pretty small muscles in the abdominal area. No fat tissues in abdominal area. Then we possibly can see the organ's shape or even some muscles show up, like a cancer kind of patient, ending stage. People pretty thin, then we possibly can see it. And enlarging the liver or spleen. So basically in that area you can see abdomen getting bigger. So still for example, let's go to the picture here. For example, like if patient have big liver, basically this part abdominal area will be pretty bigger. Let's go to like this. If on the right side mainly, that's liver's issue. If on the left side mainly, that's maybe big spleen. We still need looking for the location, then we know. So that's possible for the enlarging liver and spleen. So that's basically we looking and normally under the rib cage. So the shape will be dripping down a little bit, like the picture here. So that's the rib cage, and the abdominal area below the rib cage will be dripping down a little bit. That's normal. If you see some people lay down there, like abdominal area, still go higher like this, that's possible some issue happens inside. Yeah, we're still talking about possible liver, possible spleen, and possible some more liquid inside, water inside, or other issue. And certainly some people too much fatty. Yeah, too much fat in there. So that's basically we're looking the shape. Yeah, the shape under the rib cage should be kind of descending. Then we try to looking some movement of the stomach, small intestine. If we can see it, yeah, if we can see it, we can see like a few minutes, like to see how many times movement is there. So this kind of movement coming from stomach and small intestine, we can see only in some very thinner people. It's not everybody we can see it. But if we can see it, we can try to calculate how many times per minute. It basically matching with we hear the sound. We're talking about the aspiration later. And sometimes for people pretty thinner, we even can see the pulse jumping. Yeah, we even can see the pulse jumping. So that's some situation by inspections with specially like we can see it. So that's the first part. We're talking about physical examinations in abdominal area, inspections. Now let's move in to the next part. We say for abdominal area especially, we go to aspirations first. Other part of physical examination, usually we go to palpations, yeah, inspection, then palpations, then percussions, then aspirations. So usually aspirations is the fourth part. But for abdominal area especially, we go to aspirations first, before palpation, before percussion. Because basically we need to hear the sounds coming from the bone. Yeah. If we palpation first, or even percussion first, the sound will be changing. So that's why we go to aspiration first. We hear the both sounds first, and then we go to palpation and percussion. So that's basically we do it different order with other part of the body. So certainly aspirations we're talking about, we need to use the scalp. Yeah. We can use the same one, like we hear the hard sounds. So that's pretty commonly one. Yeah, pretty commonly one. That kind of scalp. Upper side put your ear, lower side put to patient's body. When we talking about abdominal area, we put into the lower part to the abdominal area gently. Yeah, we are not pushing too hard. Yeah, gently. And then we can hear the sounds. Basically, the sounds coming from the ball, kind of moving inside. We know that's basically small intestine in there, yeah, in most part, and certainly some large intestine. whatever, small intestine or large intestine, they have some liquid in there, mixed with the food. Yeah, some liquid water mixed with the food, and also some gas. When they moving, they truly make some sounds. So we just here try to looking under that sounds. So normally, people digest food, and the food and the liquid moving inside of small intestine and the large intestine. So that's the googling kind of sounds in there. Yeah, if you have scalp, you can try to put your scalp in your abdominal area. You truly can hear, easily to hear it. Yeah, easily to hear, like a groove, Yeah, some the people's sounds maybe little bit different. Yeah, it's depending how much water in there, how much food in there or liquid in there. The sounds little bit different. Yeah, but truly you can hear the sounds in there. So basically, what kind of sounds in there, it doesn't matter. We just looking the rate. Yeah, we just looking the rate. Normally, we say 3 to 5 times per minute. That's normal. So even little bit more or little bit less, still normal. Like from beginning, we say if people per minute over 10 times, that's abnormal. So even little bit more, like 5, 6 times, still possible normal. Especially like people just after eating food or drinking water, their sounds is increased by the rate. And a little bit less, still normal. Like we're talking about 2 to 3 minutes, just one sound in there. That's truly abnormal. 2 to 3 minutes, one sound. 1 minute, one sound, still okay. Yes, still okay. Certainly, we need to see people's other symptoms and signs. We are not only according to the sounds, but there's some generally basic idea in here. So that's about aspirations, the sounds, and the rate of the sounds. So aspirations, we are not only hear the bone sounds, we also can hear the blood vessels, like blood flowing inside of blood vessels. They still make some sounds in there. So normally, that's some location. Normally, we can hear the aorta sounds in the center. Pretty close to middle between the chest area and the umbilicus area, between the middle and in the center, that area, if you can hear some sounds in there, it's blood flowing through the blood vessels, some sounds in there. So that's usually coming from the aorta sound. So still depending how bigger of the patient. Still thinner patient is easily to hear the sounds. Bigger patient, too fat tissue there, you may not able to hear the sounds. But if you hear the sounds, still belong to normal. And you also can hear some sounds by the side part. Side part still like the same level where you hear the aorta sounds. That sounds truly not as stronger as aorta sounds, but still possible you can hear it. That sounds usually coming from the kidney artery. And the lower part, we still have some big artery there. So basically, aorta go like this. On the lower abdominal area, they separate with two branches. So that's still big artery in there. You still possible can hear the sounds. So that's the artery location, and thus you can hear the sounds here. And if you can hear the sounds in this area, that's the pulmonary arteries. So by the different location, you hear the sounds from different arteries. So that still belong to normal. But if you people too much fat tissue, you couldn't hear the sounds, still not means patient have trouble. Maybe just too much fat tissue blocking the sound transmitter there. So that's normally we can hear the sounds mainly one from the intestine movement, one coming from the blood circulation from the artery. Then we go to the next one is percussion. Percussion, palpation, it doesn't matter which one you do first, which one you do second. But truly aspirations, you should do before percussion, before palpation. So percussions, we still talking about we use our hand tapping for the patients, and then we hear the sounds coming from our tapping. So basically, we separate two different kind of sounds. We say hollow sounds, medical words we use temporal, and dull sounds. Dull sounds coming from solid organ. Empty sounds coming from the hollow organ. So that kind of empty sounds usually because some gases inside, especially like in the stomach, and certainly other like a small intestine, if they have some gases there, we still got that kind of empty sounds in there. And the dull sounds mainly coming from solid organ, like especially when they got enlarging. And also possible coming from abdominal muscles. So that still belong to solid. And when we talking about the changing, dullness sounds changing, like we see the radio. So that's basically something inside, and then they moving. That's mainly because some liquid inside. So when we're talking about percussion for the organs, so on right side abdominal area is the liver. Above the liver is the lung. lung sounds, lung sounds is not totally hollow. It's not totally hollow. It's not totally dull, but it is compared to dull. It is kind of hollow there. So when we checking about the chest area, we're talking about the lower border of the lung in the sixth intercom space in middle clavicular area in the right side. So that means upper border of the liver in there also. So thus we separate is the liver under the lung for the upper border. And we also can percussion for the lower border of the liver. Still, the sounds will be changing from dull to the empty sound. That will be lower border of the liver. So basically, we just find the dull sound on the liver. And on the left side, that's the mainly stomach right below the rib cage. So that should be kind of hollow sounds in there. So that's by the percussion, we try to find like the organs inside. So for the spleen, we say we have other organs in abdominal area, including the spleen, including the kidney. So percussion for the spleen and the kidney is not that easy. It's not that easy. If the spleen normally, basically percussion, you couldn't find it because they're holding beside the stomach area, and the stomach area they cover the spleen. You only hear the hollow sounds in the stomach area. You couldn't hear the dull sound coming out from the spleen. And the kidney located in the back part of abdominal cavity. So that part, we have a lot of muscles there. So you still heard like you hear the truly sound like how bigger of the kidney, only coming from the sound. But later on, when we especially talking about checking for the kidney, truly we still can kind of percussion in there or palpation in there. So we can find like it's not truly hear the sound. Some people maybe got tenderness in that area. So that's when we talking about kidney examination or talking about palpation in that area. We talking about, but not truly for the percussion for the spleen and the kidney. So mainly percussion, we hear the sounds coming from the liver and coming from the stomach. Gastric, the same meaning of the stomach, medical words. So that's our percussion part. Percussion part. Then we talking about palpation. Palpation. So palpation, we have lateral palpation. So lateral palpation, so basically we just feel the abdominal area, feel some tenderness in there if they have. And also it's muscular resistance. What means muscular resistance? So when you're touching some people, their muscles, let it be contraction in there. You feel it's not too soft in there. not too harder in there. That means no more muscular resistance in there. Too softer, it kind of deficiency. Too harder is excessive condition. And also we try to palpation for some superficial organs. Basically, if patients normally, you are hard to by the lighter palpation. But if some organ getting bigger, lighter palpation, you still can find it. And some muscles. So that's basically for lighter palpation. And also you start from lighter palpation, and then patient maybe let it be relaxed. Then you do deeper palpation later. So that's just show you how we do later palpation. Yeah. We go to different part of abdominal area and gradually moving your fingers, like usually go to lower part, moving to upper part, and from one side moving to other side, and then ask patient if they have some tenderness in some area, and then you feel the abdominal area, how softer or how harder. Yeah, basically I put a few lines here, means you palpate gradually. Yeah, gradually. Certainly your palpation should be cover all the abdominal area, not just for local area. So that's our lighter palpation. Then we move into deeper palpation. So deeper palpation, basically, we try to figure out maybe some muscles in there. And also for some organs, like the liver. So normally, we don't have abdominal muscles. If we find muscles, that's be abnormal condition. So then we try to find where it located, how big it is, and what kind of shape in there. And if some painful tenderness in there, or maybe you can feel the pulse in there. Yeah, truly the muscles can come in from different sources. Some muscles, maybe just the tumor in there. Usually, these kind of muscles, you couldn't feel the pulse. Some muscles may be coming from enlarging the blood vessels. So just the blood vessels from the tumor there. So in this kind of condition, you can find the pulse. So that's we say we try to find the pulses. And is mutable or not mutable, especially follow the respirations, or maybe follow the we check follow our hand, is mutable or not mutable. So that's basically if we find some muscles in the abdominal area, we need go to some detail. So that's the picture people do deep palpation. Deep palpation. You can use two hands. Yeah, that will be easily for deep palpation. Certainly, you still can keep for one hand if deeper enough. And you still moving from lower part, go to upper part, and deep palpation in there. And certainly, if you find something in some special location, you can, like around that area, go to more detail for deeper palpation and moving that area, moving your hand to see the muscles is movable or not movable. So that's generally deep palpation for the muscles. Then we specially go to the organs. We say for abdominal area, we specially checking mainly for some organs. Liver is the biggest one. Yeah, liver is big. So when we checking for the liver, so certainly we can do inspection, looking right side upper quadrant is bigger or just normal there. And certainly with mainly part is palpation. Yeah, mainly part is palpation. We're talking about some detail later. Yeah, palpation. And then with percussion. Percussion, we find the dorsum. That's the liver. So basically, we still calculate how bigger it is by the middle clavicle line. How bigger? Like how many centimeters below the rib cage in the middle of the clavicle line area. So we are not truly used for aspirations for the liver because they don't have special kind of sounds normally coming from the liver. So basically we use 3 ways to checking for the liver. That's the physical location of the liver. Liver have 2 lobes. The big lobes on the right side, yeah. The small lobes on the left side. So normally, if we go to like a middle clavicle line and whatever with percussion here or palpation here, it's a little bit below the rib in there. But in the center line, get more, we can feel more. So that's the normally, normally. If you couldn't feel it, still okay. Some people's rib cage is different shape. If you couldn't feel it in the middle clavicle line, still okay. And certainly some people have big muscle there, big fat tissue there, you are hard to feel it. But truly, when it gets bigger, that's be the trouble. So that's for basically for liver. So how bigger means bigger? We need to know how bigger is the normal first. So the normal liver, we say the distance from the upper border to the lower border. That's about 6 to 12 centimeters. In the right middle clavicle, certainly in different parts, like a little bit smaller from right side to left side. So we must be follow the middle clavicle line there. Then about 6 to 12 centimeters. Usually people not like liver smaller than 6. Just you couldn't feel it. Just you couldn't feel it. But truly it's bigger than 12 centimeters. That's some issue or big liver in there. And if we go to middle sternal line or middle center line here, so basically it's about 4 to 8 centimeters. So that's compared with middle line, liver in this area is a little bit smaller. So that means if bigger than this number, usually people got big livers. Then we still talking about we checking for the liver here. Palpation. We say checking for the liver, mainly palpation and percussion. So like we talked about before, we standing on the right side of the patient. We use our right side specially palpation for the liver, but we can put our left hand under the patient's, and about right 11 and 12 rib area, and supporting there, So in this way, you are a little bit easily like you lift the liver upward, and then little bit easily to feel it. So that's why we put this hand here. That's your left hand support the liver, more go to upward. Then your right hand palpation. So we can use two hands together. And then we're talking about tell the patient relax. Tell the patient relax. If patient not relax, basically you're pretty hard to feel the patient. So relaxing, tell the patient bending the knee. That's some way to help patient relaxing. And then put your right hand on the patient's right abdominal area. Lightly to the rectus muscles. When you go to anatomy, you know rectus muscles basically in the center. And then your fingers, moving from lower abdominal area, gradually moving to upper abdominal area. So basically, like you can percussion first, and then you find the lower border of the liver, Then with your palpation, you start below the lower border of the liver, then gradually moving up. Like push your hand there, then tell the patient deep breath in, then you can feel something moving under your finger here. If you couldn't find it, then you go to upward a little bit. Sometimes you feel it by the top of your fingers here. You feel something just moving. Follow patient's respirations, then moving, passing your fingers. So that's the way we palpation for the liver. So right upper quadrant area will not only have the liver there. We also have the gallbladder. So if some people complain, right upper quadrant area painful in there, or tenderness in there. So one issue possible is liver. Another issue possible is gallbladder. So gallbladder issue usually happens like acute inflammation in there. Patients suddenly feel painful in there. Liver issue got painful issue. Little bit slow, like a chronic process. Gradually happens. But gallbladder issue, gallbladder infections, they like acute process. So when we checking for the gallbladder issue, we have a special kind of test. We call it Murphy's test. We say for medical words, lot of tests, we use the doctor's name, like he finding this way to test. Then after people just use his name as the test name. So that's we call Murphy's test. So how we do the Murphy's test? So basically, use the fingers, use your fingers under the ribcage area. So that location, still beside the reactive muscles there. And then you're holding your finger there, and ask a patient, get a deep breath in, If patient have liver or gallbladder issue there, mainly for acute one, is gallbladder infection happens in there. When they deep breathing, will cause the painful situation, and they will be automatically stop breathing because painful. So that means Murphy's test positive. That truly means patient have liver and gallbladder issue. Mainly it's gallbladder infections in there, or maybe some gallbladder stone caused infection kind of issue in there. So that's we say Murphy's test. Murphy's test. So the location, right side upper quadrant area, still close to middle clavicle line here, and holding your finger there and tell the patient deep breathing. So that's we say mainly is gallbladder infection in there. but still possible liver issue. We need other chest examination for identify what kind of issue in there. So that's we talking about the morphic signs. This radio is negative. Yeah, negative is normal. Yeah, negative is normal. So this radio, the patient's morphic signs is negative. But if patient got some painful situation, it is positive. Yeah, it is positive. So positive truly patient have issue in the gallbladder or maybe liver. So that's the morphic signs. Yeah, morphic signs. Another important test in abdominal area. We call it McBurney's points. Yeah, McBurney's points. So still use doctor's name. Yeah, still use doctor's name. So points means some special location. Yeah, some special location. So where it located? Where it's located? We make a line connected of umbilicus with ASPS. Oh, ASIS, sorry. Yeah. ASIS. Yeah, ASIS. So we make a line connected together. Yeah, when you go to your anatomy class, they still specially talking about where is ASIS. Basically, it's on the hip bone, yeah, anterior part of hip bone. That's like a bump in there. Yeah, we call it ASIS. We make a line connected with umbilicus and separate with 3 equal parts. So the point is located lateral side 1/3, meeting with middle side 2/3. So that point is here on the right side. Yeah, still on the right side only. Yeah. Like a gallbladder, like a morphic, we test for morphic signs only on the right side also. Gallbladder location on the right side also. So these points we specially name it McBurney's points. So we tested to see if some painful in that area, like by the palpation, especially go to these points. And also patient possible have some rebellious pain. So whatever, that means positive. Positive means patient have inflammation in the appendix area. So that's basically patient have sick and inflammation in the appendix area. So that will cause the test for McBurney's points, rebellious pain in there. So that's 2 special locations. One we test for gallbladder, one we test for the appendix. Now we're moving to checking for the kidney. So kidney located in the back part of the abdominal area. So pretty close to the rib, 11 and 12th rib. And also remember, right side of the kidney, little bit lower compared with left side. So we say like a 12th rib here passing the center part of the kidney. But the 12th ribs on the right side passing upper 1/3 of the kidney. So right side of the kidney lower because above the kidney on the right side we have liver in there. And still remember when we're talking about like we checking or some line and symbol in the body, we have a special angle here. So basically we're checking the kidney in this angle. So that's basically physical location, the kidney. So basically checking for the kidney, percussion. We are not truly going through the palpation to find the kidney because back area we have rib in there, protection. We have a lot of muscle in there for protection. So basically we percussion. And looking not truly find something. Aspirations not truly find something. So percussion. So that's the way we can percussion. So that's what we call indirectly percussion here. We put one hand pretty tight to the skin and another hand percussion over the other hand. Then we ask the patient if they have some painful situation. If they have some painful situation, that means positive. That means patient have issue in the kidney. So that's pretty useful clinically. Like a patient complain about lower back pain. So we try to figure out that kind of pain is coming from the muscles or coming from internal organs, especially the kidney. We can do the test like this. So certainly if the painful situation coming from the muscles, when we percussion, patient will not feel severe kind of pain. If the situation coming from physically or kidney, patient will feel pain. And sometimes we compare both sides. One side is pain, the other side is not pain. That's just one side kidney have issues. So that's basically we test for the kidney.